the way I thought we could do this, Dev, is as I kind of emailed you a little agenda, but basically I'd love to kind of just spend a little bit of time on you and your story, and then segue from that into maybe kind of a couple of lessons learned along the way, kind of key insights, if you like. And then we're going to get into life sciences. And I've got lots of questions about life sciences. Does that sound good?
Sounds great.
Okay, awesome. So let's start at the beginning, Dev. And I kind of want to start with, like, where did it all start for you? And like, let's go right back to the beginning. Like, what were you born into? And what was the world what did the world look like when you were born?
That's a great question. 1974, so monochrome. So it was
three channels on TV.
3 channels on TV, and I was a remote control, having to change each channel for my parents. Yeah. I think we can all relate to that. So my parents were from India and emigrated over. My father in '66, my mother in '67. My father classically told this story of him arriving on the day that England won the World Cup, which I think is embellished over the years. And he said, I got to this country and it was crazy and everyone was dancing in the streets. And I sort of said to his older brother once, who lives over in Harrow, so is that true? And he was like, no, not at all. Your father's just made that up. But it was a great story. So they...
Where in India had each of your parents?
So my mum was in what is now in India, in the Punjab, in Ludhiana, and my father was in actually what is now part of Pakistan, so a place called Pakpatan. So he actually, which he never really spoke about until 2018, he never really spoke about the partition and actually having to migrate over what is now the border, which I found fascinating because obviously, as you start to dig deeper and you see that was one of the largest migrations in human history. And I was like, wow, you went through that when you were 2 or 2 or 3. That's quite something.
And people, families having to leave everything behind and just do what they could carry.
You came from a sort of a fairly well-to-do family. They owned a lot of land and, you had a lot of horses and all left behind. Literally, it's what you could carry across the border. That's what you would sort of then arrive at your new location, which I found interesting, very interesting.
So how old was he? How old was he going through?
He was 3. He was 3.
And was his brother? You said you talked to your uncle. Is he older or younger? The brother.
He's older. So my father passed away 5 years ago, but his brother, he's in his sort of mid-80s now, and he doesn't talk about it either. It's very interesting trying to get that sort of period of history out of them, because I think obviously they were young, but I think it was also a part of them that I think is very deep, very personal, deep-rooted, but they don't necessarily want to discuss. And I think that's probably a generational aspect as well, in that, you didn't really talk about emotions. It was that sort of typical generational thing where, you suck it up, as we would say, stiff upper lip, get on with it.
Well, it just must have meant so much to them, and in the family psyche as well, having to go through that. So do you know much at all about what that family history was, what they were leaving behind? You said they had land, horses.
Not much. They don't really talk about it. I mean, his elder brother is over in Harrow, and the rest of his family moved to Canada, about 35 years ago. So, I think for a lot of them, it's just deep and buried. It's part of what they were, but they don't really discuss it. So it's a real shame, because I had hoped before my father died that we would be able to go away back to where he was born and actually sort of see the village over in what is now Pakistan. But sadly, COVID hit, and we weren't really able to do it.
Yeah, gosh. Yeah, that's really, really poignant. And that these kind of family histories, they do die out, don't they?
They do.
Yeah. And is your mother still with us?
She is. Sadly, before my father passed away, she was diagnosed with Alzheimer's, and she's got severe Alzheimer's. So she's been in a nursing home, residential care.
Gosh.
Since 2018. gosh, 2019, September 2019, and that's been quite an interesting and powerful journey for the family, because she's now got to the point, well, actually over the past sort of 18 months, where she doesn't recognise anyone, doesn't recognise
Oh,
me, my brother, the grandchildren. So the children in particular find it really difficult going to see her. Um,
right, because they've got to know her really well. I mean, they,
yeah, the
she's
twins,
been in their
they're
life
three.
a long time, and they're
Correct.
because they're
Yeah,
getting they're kind of in their late
yeah.
teens now, aren't they?
Yes, absolutely. The twins are certainly, and
Yeah.
they can remember, Granny coming around to look after them, when they were 3, 4, 5, playing with them. But yeah, that part's sort of gone, and it's interestingly, Harry in particular has found it galling.
Hmm.
He's found it really difficult to cope with.
Hmm.
Amelia is a little bit more sanguine about it, I think, and just accepts it for what it is. Um, but it's been an interesting journey, and my brother's of a similar perspective as well, in that actually there's no point exposing the children to it now because it's just too traumatic for them.
Yeah, gosh, what a difficult thing to be navigating, and that must be really tough for you and your brother. I to be honest, I can't really imagine it. I mean, my my great grandmother, I remember, she went through that, and my parents got married very young. My grandparents got married very young, so I got to know some of my great grandparents, and so I was about 17 when my great grandmother died, and she had, in the last years of her life, gone, quite advanced dementia, and in fact, the family's approach was, best for everyone to kind of stay away, like remember her as she was, kind of thing.
Yes.
Um, but of course, as my great granny, I loved her, I was very fond of her, but it wasn't obviously like the connection that I would have with my parents, and I can't really imagine what that's like when they don't recognize you.
I think it was. I had suspected for a while that Mum had dementia, and to a certain degree, and this is going to sound awful and really cold, but when we put her into the nursing home, that was almost me saying goodbye then,
Mm,
because at that point I knew she wasn't the mother that I'd grown up with, that had looked after me, that I could talk to. So that part had almost gone.
mm,
Still very much my mother, but actually she's not the person with the characteristics that I loved.
mm.
So so for me, it was a gradual acceptance, and it became. I'm not going to say it becomes easy. It never gets easy, but there was an acceptance and a realization that this is what it is. By the way, this is a terribly sort of darkened way to start this meeting.
Well, but hey, I mean, this is life, right? Isn't it? This is,
It is. It is.
and particularly maybe for, we're the same age, so we're in that zone, aren't we? With parents getting older, we've got
Yeah, yeah,
children getting older, and now we've got parents getting older, and so it's into that whole thing, which is,
yeah.
um, obviously becomes very significant, in your world. So let's take it back to your parents. They've both on their different journeys, they've made
Yes.
their way
Yeah.
to the UK. So they then meet in the UK.
They did. They were working over at the Hammersmith Hospital in London, and they met as junior doctors over there and started dating. And possibly somewhat unusual back then for Asian individuals, in that there wasn't an arranged marriage. They fell in love. They dated.
Hmm.
Their parents were over in India at the time, and they dated or courted, as I think the term my father used to use. They courted for about 18 months, and then they my father proposed, and their parents came over to the UK, and they got married in Eastbourne, if memory serves me, which I think one of them. I think they were both working down on the south coast at that point in time in their various sort of hospital jobs. And
So they're
yeah, they
both medics.
both medics. Yeah, yeah. So dad was an ENT surgeon, and mum was an obstetrician and gynecologist. But then they actually both requalified as GPs and set up a practice together. But they still maintained their hand at the local hospital doing ENT and obstetrics.
Oh, oh, so they went into business together.
They did. They did.
And
Which
where was the practice?
so it was over just on the outskirts of Slough.
Ah,
So yeah, so
amazing.
they that was 1973. I think they set up the practice together, and then I came along in '74.
Mm-hmm.
Um, and yeah, from then it was very much they just. I mean, brilliant work ethic. I think the one thing that I will say to them is that they work furiously hard, and I think that's something that they instilled in my brother and me in terms of you're not going to get anywhere without putting the effort in, son. And so I take my hat off to them. But yeah, they had a
There's a kind of I mean, this is just like massive stereotypes, but like that kind of work ethic, Asian work ethic, that's a thing, right? I mean,
it. I think it is. I think it is to a degree. It's interesting you say that because I was talking to Karen, my wife, the other day about it, and we've seen um, at Hector's school. So Hector's 10. He's at prep school, and in his class, he's in the top set for maths, but he's not struggling. If I'm being completely honest, I mean, I don't think he's sort of a natural maths genius. But there are a couple of boys there that have already done their maths GCSE, and they're 10. I'm like, well, that's ridiculous. And I said, well, do you know anything else? And Karen said, yes, I think they're both Chinese. So again, not to be stereotypical, but I
yeah,
think
but right,
from
yeah.
a very early age, there's that work ethos that's just installed
Yeah.
into, certain individuals. I'm just
Mm.
thinking, gosh, at 10, I could barely do up my laces. I'm like, let alone do GCSE maths. It's quite phenomenal.
Yeah. Extraordinary. So you and your brother were born into this hardworking medically focused family.
Yeah, so there's 9 years between me and my
Okay.
brother. So my mum fell pregnant again when I was 5, but sadly, she lost the baby at 28 weeks. Um,
Oh wow.
and back then, 28 weeks, from an obstetric perspective, you haven't got a hope in health. It's not like
Mm.
medical technology and advances today. And so there was a long period, before my brother came along. So when we were younger, we weren't particularly close because there's just that age differential. But over the years, that's narrowed, and we're now very close. But
Yeah,
we had a
of
very
course.
comfortable upbringing. Sort of lived in sort of leafy suburbs, half an hour away from London. Nice house. So I certainly look back and I think, gosh, I was very lucky in terms of how I was
Yeah.
brought up, and as you know, the schools that we went to, they were great schools. For me, they were actually local schools. So
Yeah, so because you went did was your prep school, was that boarding?
that was, but it was only compulsory boarding in the last 2 years, and because I only
So
lived,
you were nearby, so you could do the day school
I was day
beforehand.
school for 4 years and then boarded for
Yeah.
the last 2 years. But the school was only a couple of miles away, so it was very, very easy. And as both my boys have gone there as well, so it sort of feels like
Mm.
there is a little bit of tradition there. When
Nice.
Hector leaves, that's going to be sort of 26 years of the Kumar family having propped up the coffers of the school. So I'm hoping
Yeah, right.
park bench or a tree plant somewhere.
Making
Yeah,
generous donations for 20 years.
correct. So they're all very, very local. So it was a comfortable upbringing. The one thing I will say though is where I grew up. So it was in a place called Stoke Poges.
Yeah.
It's There weren't very many young kids around. So actually, me growing up was very much me as an only child at that point in time, having to get comfortable entertaining myself. Both parents were out at work, so it was like, okay, we'll get on with it. And that I think was character building for me. I think, I didn't look back at it and go, "Gosh, if only." I look back at it and go, "Well,
Yeah.
it's looked me that actually you just have to get on and do it. You've got to entertain yourself. You've got to be comfortable. You've got to find something to do." And I think that's a really important lesson that I've learned. Conversely, for certainly my boys right now, it's always a case of, I'm bored. What are we going to do? Can you take me somewhere? And it's like, well, you need to also entertain yourself. You need to learn how to be a little bit more, you know, proactive.
Yeah, no, exactly. Yeah, and so different for your twins to grow up, obviously together. They've always had each other.
Yeah.
Um, so that's a very different experience. And so was it prep school was that where rugby was discovered?
that was where rugby was discovered, which, coming from Asian heritage, wasn't a natural fit necessarily, but loved it, absolutely loved it. Started playing when I was 7, and it's interesting now because obviously with England RFU, there's a lot more guidance in terms of what you can and can't do at various age groups. Back then, you just get stuck in. It doesn't matter. It's just you throw yourself in there, rucks and mauls, and it doesn't matter that it's -5 and the ground is frozen. It's like off you go.
Oh yeah.
Different time period, different generation. But yeah, absolutely.
I remember that.
And I wasn't the best. I was good, and played 15s and 7s. But it was something that stuck with me for life, and I ended up playing for about 20 years until finally my body taught me that I could no longer do it.
It's a sad moment for every rugby player when they have to finally acknowledge that this isn't working.
I remember. Sorry.
Go on.
No, because I was still playing when I was a junior doctor. I was an obstetrician and gynecologist. I remember my consultant one day saying to me on a ward round on Monday, "Dev, look, can we have a word at the end of the ward round?" I was like, "Yeah, of course." And he said, "You got to stop playing rugby." And I said, "Why?" And he said, "Because you're frightening the patients. You're coming in with sort of, a black eye or, a cut lip." And I was like, "Yeah, no, that's a good point." He said, "I don't want you scaring all of my patients into labour." So it's like, fair enough.
That's funny. Well, you see, so we met when at Eton, and that's where we first connected. And I remember you as being a pretty big guy, actually. It's that thing where everyone's growing at different stages, and I remember you as being like one of the 3 or 4 guys who, this is like how my brain works, like who arrived at the school shaving. These guys are men, and I'm very much a boy still. So I didn't go through puberty until quite late, and so I kind of noticed these things, and so you arrived like this big guy, and probably quite a presence on the rugby field, I imagine.
Well, it's interesting you say that, because I think looking back in hindsight, when I was playing at prep school, I was second row. And I'm 5'9.5", and the half is very important. So what it tells you is that I went through puberty then and then stopped. So as soon as I got to Eton, to your point, I probably was one of the taller people, but then all of a sudden everyone, overtook me, shot up. So yeah, it's interesting to see people going through puberty, and boys in particular at just different ages and different times. And you see it now, and often, watching prep school rugby. There was recently at Hector School, there was a 10s tournament, which is a sort of, a hybrid of 7s and 15s. And there was a touring team from Dubai. And some of the boys there must have been 6'2", 6'3", and they're 13. And, like you say, point, that they had stuff like, wow, and then you've got some boys that are sort of, barely 5 foot. And you think you can't have that at that level, because that's actually dangerous.
Well, I think in the South Pacific, they started discriminating on weight, didn't they? Yeah. Rather than on age, categorizing on weight rather than age. So, which I guess makes sense. And then also I think the other thing that, we spoke about this the other day, but when we were at school together, you were also notable in that you kind of had your own style in a way, your own sort of, you were very much, and maybe lots of people were doing this in their own different ways, but I do remember you particularly kind of, it's like you seemed very clear about who you were and what you were about. And, that there was a sort of confidence in that, like very positive presence is my recollection, but, but also a kind of willingness to kind of do your own thing in a way. Does that resonate?
It does. And it's interesting you say confidence. And I think there was an element of it being, to a certain degree, confidence and being comfortable with who I was. But it probably was a little bit of a defense mechanism as well. I think, I may have shared with you, growing up with Asian parents that emigrated in the 1960s, I was, to their friends, I was too white to be considered Asian, and everywhere else I was too Asian to be considered white. So it was very much trying to carve out an identity for me and someone that I felt comfortable with. So I learned from an early age, actually, to a certain degree, it doesn't matter what people think about you. Just do what you enjoy doing. And I was an Asian rugby playing, post-punk goth so I didn't fit a particular mold. So I'd go to these gigs in London and around the country, and I was probably the only guy there that wasn't white, and they were like, okay, I couldn't really, they couldn't point at me or pick on me because they weren't really sure who I was. So actually, for me, it became very, very affirming, very positive, and it actually helped me to develop my identity and say, just get on and do what you want to do. Actually, fundamentally, it doesn't matter. As long as, I've always said, and I say this to my children as well, it doesn't matter who you are or what you do. As long as you're fundamentally respectful and tolerant of other individuals, get on with it. It doesn't matter what people think of you.
Well, I think that really speaks, Dev, to some, I was thinking about this before our conversation, and to some kind of core traits or themes, that I would attribute to you. So one is that kind of authenticity and the willingness to very much be who you are, and that is something that's positive. It's not like against anyone. It's just very much a statement of being in integrity with self, really, is the way I look at it. And then also that kind of very deep sense of values and integrity, so that that would be a high priority. And that's just something I get about you, Dev, is that you live with a very strong sense of values. I mean, is that something, and that's really what you just described in your communication with your kids, like this is what's important. And is that something that is very conscious for you, or is it just something that's just how you roll?
I think it's it's probably who I am. I think that it's more innate than anything, but I am conscious of it as well. And I think a lot of execs, I massively suffered from imposter syndrome during my professional career, more so during the transition to law than I think from medicine. But I was very conscious that I wanted my team in particular to be developed, to have the opportunities there, to have someone that wanted to mentor and develop them. So I think for me, that was the authenticity, and that was something that I'm very keen on pursuing. So I still mentor law students, medical students, and I really believe that, having someone that you can look to, you can bounce ideas off, is good for the future. As succession planning, I feed off it. It gives me a sort of a positive energy as well.
Was there something about the way you were raised, do you think, that you got that from your parents in any way? Like, were they modeling that in some way, or?
From my mother, yes. From my father, no. And without, this isn't a criticism of my father.
Sure.
I just think it was a different generation and a different time. It was like, son, just get on with it. Suck it up. I'm not going to sit here and talk about how was your day at school. Why did things not go well for you? Just, why did you get 99%? And what happened to the other 1%? It was, that was very much my father. Whereas my mother, I think, was certainly more the empathetic, caring, nurturing. But I look back positively at my upbringing, and I think hopefully, we all do. We all want to try and do the best by our children. We all want to learn from the mistakes as well as the positive experiences that we've had, during our childhood.
Yeah. Yeah, and so that kind of values-led and very much a commitment to being authentic, true to self, that I think has really fed through your professional journey as well, which has been really interesting and I think quite unusual as well. So you leave school, you go to uni. Do you study law at uni?
No, I studied. So I studied medicine. So when I was at Eton.
Sorry, yes, you studied medicine. Yes, medicine first. Yeah.
So it was very much a choice between. There were three things that I wanted to do in life. Actually, there were four, and the one thing that I really wanted to do, and it was never going to happen, was be a cattle farmer. I absolutely was just obsessed.
Amazing. Where did that come from?
I don't know. Absolutely no idea. And, when my parents said, what do you want to do? And I was like, I want to be a cattle farmer. They were like, no, right, next thing, what do you want to do? And I was like, okay. Yeah. So we're giving you two options here, son. It's medicine or law, So actually, medicine was the safe option. My parents were medics. I was fascinated by science and technology. But law was the other thing that I was seriously considering. The other thing that I was wanting to at one stage do was politics, but I actually don't think I'm thick-skinned enough to do it. And I couldn't really see a natural route in. So I sort of disbanded with the idea of politics, and it was a real sort of, toss-up between medicine and law. And I went for medicine just because I think the science probably won in the end.
Mm-hmm.
As back in the day at school, there wasn't really much of a careers advice that there is now. It was, what
there was none. Like, we were in this unbelievably amazing school, which had just unbelievable everything that you could possibly wish for. And I remember going into the career. There was a careers room or something.
Yes, there was.
It was like a little cupboard with some leaflets, and you kind of go, I don't know what to do with this.
It was like, well, surely you're either going to go into the city, or you're going to go into the army, or you're going to go work for your father's firm.
Yeah,
so it was,
right,
that was pretty much it.
There's no need for any advice. Exactly.
Yes, correct. So I went to medical school, and I went to Guy's and Tommy's, or UMDS as it's now King's, and it was very much for me. I not that I would ever have got into Oxbridge, but I took the concerted decision that I wasn't going to apply, because I think I needed to escape Eton. I needed to escape that sort of cloistered environment, and I wanted the freedom, and London offered that freedom. So for me, it was just a hallelujah type moment in terms of, you're not having to be anywhere at any particular time. You haven't got tardy, but any of the things that, we all experience. And I had 6 very, very enjoyable years over London. So in my 3rd year, I did I took a year off, and I did a psychology BSc, which is quite typical for sort of medical schools. You can condense a BSc in 1 year.
Wow!
And then went back.
I didn't know that. That's impressive.
Yeah, it was interesting. At the time, I think I did it because I thought it was probably the easiest one to do. In hindsight, having done it, it's actually probably really helped me. Just understanding people, and just how team dynamics work, and so it was very, very interesting. Did my clinical part, and over at Guy's and Tommy's, and then did the sort of typical junior doctor role of being posted all over the country, which was actually really enjoyable. I knew from an early medical career stage, that I wanted to specialise in obstetrics and gynecology, because I really wanted to go into, I wanted to do oncology, gynecological oncology. My father, I can remember saying, he said, "So what are you going to specialise in?" And I said, "Obs and gynae." And he went, "Why?" So what's wrong with you? He said, "That's not a proper career for a male doctor." And I was like, "What?" So,
wow,
50% of the population, Dad, believe it or not, are female. So actually, it's okay. My mum was an obstetrician gynecologist.
Well, yeah, right. So you were following that path that your mum had already.
I found the whole. Yeah, I found the whole concept of actually treating 2 patients, from an obstetric perspective, interesting at the time. It's like, you're not just dealing with the mother, you're dealing with the unborn child as well. And that for me, posed so many interesting challenges and potentials.
I was really struck when Antonia gave birth to each of our boys, and both times I just was having this amazing awareness that I was being confronted with this absolute miracle of life. It's just completely mind-blowing.
Yeah.
Like, from my point of view, there wasn't a child here, and now there is a child here, this being. And it's the realization that all of these medical practitioners, this is their regular day. This is their daily thing. Like, this unbelievable. And I'm not trying to have rose-tinted windows, but I was just kind of thinking, an extraordinary world to be in.
It's an incredibly privileged position, and I look back now, and actually those were probably my most fulfilling years, because you suddenly realise you're sharing an incredibly poignant, life-changing moment with complete strangers. It is incredible. You're absolutely right. It's that moment will forever be etched in the parents' minds, and it will hopefully be etched in yours. And I thought I'm not taking that for granted. And I've kept some of the patients would often give you a sort of picture afterwards or a thank you card, and I've kept all of those in a little treasure box, because I look back and I think, it was absolutely wonderful.
This is a completely random thought that's just popped into my head, but have you ever had one of those moments kind of out in the world, in the public, on a plane or somewhere, where someone's gone, "Oh my gosh, there's someone giving birth. Is there a doctor?"
No, I haven't had it with someone giving birth, but recently I did have the "Is there a medical doctor on board?" And I was like, "Oh God, I haven't practiced for 15 years." And so luckily someone went yes, and I was like, "Fantastic!"
Right.
Like, unfortunately, the patient was absolutely fine, and I think he was sort of a mild cardiac episode, but he was escorted off and walked off the plane.
Okay.
But it did mean we got a priority landing spot as well, so there was a plus side to.
Okay, there was a plus. Well done,
Yeah.
that person. But you didn't have to compare qualifications with the other persons.
No, it's a cardiac episode. I'm an ex-gynecologist, so I'm pretty useless. Yeah.
That's funny. So how long did you practice then? Because you then went into that.
9 years.
Did that,
Yeah, 9 years.
9 years, and then what was the process of, okay, there's something different is going to be for me?
So I started off wanting to be a gynecological oncologist, and I did a year over in Cambridge at Addenbrooke's, and this was back in 2000, and I suddenly realised back then that there was very limited treatment. It was aggressive surgery, chemotherapy, radiotherapy, and often you'd be treating Mrs. Jones all week, and then you'd come back after the weekend, and the bed would be empty. And I realised then that I didn't have the mental fortitude to do that. So I just didn't have that strength, and I take my hats off to oncologists and people who work with terminally ill patients, because it wasn't for me. So I flipped and decided to go into IVF then, and that's where I specialised, and I did that, and that's where I met Karen, working together over in Oxford, and absolutely loved what I was doing. But it was a little bit like Groundhog Day. There were about 10 conditions, and every day would morph into every week, and every week would morph into a month, and I just thought, I'm not sure I can do this for 40 years and then retire with a certificate and a golden carriage clock, after 40 years tenure. So I thought, well, what else do I want to do? And I was always really interested in law, going back to, what I said earlier about school. But I thought, if I do law, and I spoke to a friend actually who was a couple of years above us at school, and he is a partner in a Magic Circle law firm. And he said, well, why don't you go into law and do life sciences? And I was like, well, what is life sciences? He's like, well, it's what you're doing, but on the other end of it, you're the practitioner, but it's the people that are producing the technology of the medicines. And I thought, gosh, that sounds really interesting. So I thought, well, maybe I can leverage my experience here. So I was very fortunate that at that point in time, Karen and I were living over in Dublin. This was pre-kids. We lived there for 3 years, and I was working in a fertility clinic there. And I called up speculatively a law firm and said, really interested in coming and spending a couple of weeks with you on a vacation scheme, and can I do it? And they said, yeah, absolutely, come along. And ended up going there and worked with this fantastic lawyer who I'm still in touch with. She's now moved to a different law firm, and she took a punt on me. And I was a very, very unusual candidate, because traditionally you go to law school, you do your conversion course, and they really want 23, 24, 25-year-olds who they can groom, mold, shape into what they consider partner track. So get you up to the top. You're going to be with 40. I was this mid-30s individual who'd done 9 years of being, a medic, but they took a punt, and it worked out really well, and had such great memories being there.
So then you were training with them and going through your qualification whilst interning with them, essentially, or training with them?
What they basically do, and what a lot of law firms do, is they will fund your training, so the 2 years, and then you will go in and then do your training contract with them for 2 years. And it was an interesting time from a personal perspective, because I'd given up, being a medic, and it had been a very relatively successful career. Karen was now pregnant with our twins, so we'd gone from having 2 really good salaries to actually now I haven't got a salary. I've paid and twins, and it's like, this is a massive punt. And I'm thinking, that was a lot of deep soul searching, thinking, have I just made a massive mistake? Have I given up the security and tenure that I would have otherwise had, because I should have been applying to be a consultant, and I've now got.
What was your dad saying?
At the time, actually, to be fair, they were relatively supporting, because I think he was getting disillusioned with the NHS at that point in time. And he was also coming to the end of his, I think he had retired at that stage in any event. But he said, look, if that's what you want to do, just put your heart and soul into it, make a success.
Yeah, and you weren't saying, I'm going to go and be a cattle farmer, so...
Right, correct. Yeah,
he was on side.
Yeah, I'm not going on a gap year to find myself, to discover myself. It's
Yeah,
like, okay, you're
yeah,
going to go into something that at the end of the day is
yeah,
a relatively safe profession. So yeah, as long as you can, and it made a difference securing the training contract, knowing that actually, I was going to go into a firm in the city and work there. So he was like, yeah, look, if that's what we want
yeah.
to do, good on you. So I stayed there for about 5 years, and at the time, all of my clients that we would service were essentially life sciences. So they were big pharma, they were always innovative, so big pharma, biotechs, medical devices, and absolutely loved doing what I was doing. But the biggest frustration was I never got to see where the story ended. Because they'd come to you for advice and you'd give the advice and hopefully the advice was correct and they'd go and implement it. And then you were like, and now what? What happens? And I thought, I need to understand the big picture. I need to be part of that to see it all play out, from the genesis of the problem right the way through to the resolution. So for me, that was a pivotal point in, okay, I
Mm.
probably need to move in-house now and actually take forage into industry.
So how many years? How many years were you working at the law firm?
5.
5 years at the law firm, and then you go, right, I want to get in-house.
Yep. Yep.
And did you have an idea of what kind of pharma life sciences business you wanted to be in?
No, but at that point, I got approached by one of our clients who said, "Look, we're looking for someone to come in and join our team. Would you be interested?" And I'd worked on a number of their matters before, and I thought, "Gosh, actually, yeah, it would be interesting." There was a lifestyle decision as well. Karen and I were living over in Maidenhead at the time, and I was sort of commuting into the city every day, and I was probably
Mm.
spending about 3 hours traveling, and I never got to see the kids until the weekend. So it was very much I was a weekend father, and I struggled with that during their early years. I really did. That was really difficult because
Mm.
I'd sort of leave on a Monday, and the next time that I would actually have any contact with them would be on the Saturday morning. It was like, I can't
Mm.
do this. So when the opportunity arose to go in-house, I realised that actually it was a 25-minute car ride. I was like, 100%, I don't have to get up and leave the house at 6 a.m. and, I'm going to be back well before midnight. So it was an easy decision to make as well from a personal perspective.
Yeah.
And one that was very rewarding, and I think it benefited me. It certainly benefited Karen, and I hope it benefited the twins. Although, being teenagers now, it's difficult to know. You never really get the sort of the gratitude that you were hoping for.
Oh, well, Dev, having had the opportunity to meet your kids a couple of times recently, I mean, they're just absolutely charming.
Yeah, that's very
They're
kind.
just wonderful, wonderful, wonderful kids.
That's the
See
credit
that
to
a mile
Malcolm.
off. Oh, I think it goes all the way around, I imagine. But yeah, uh, yeah, and it's
Yeah,
funny,
so
isn't it? Because I think sometimes you need to hear that from other people, like maybe when they're younger, when they're going through those kind of early teens. You're like, what has happened to my child?
yeah,
And
100%.
and then someone says to you, oh yeah, we had them to stay, and they were just so lovely. You're like, oh,
So lovely.
thank
So
God,
polite.
because I
They're
thought
so
I thought
polite.
they had
So
turned into a
polite.
monster.
Absolutely, absolutely. That's the right way to be. But I think, yeah. So for me, that was that step into industry was another pivotal point in my career, and it really opened my eyes up to the world of life sciences. So started off at Boehringer Ingelheim, so big family-owned German big pharma company, and I sort of ended up heading up their UK and Irish affiliate. And then after a couple of years, got approached to come over to Biogen, so US biotech, listed. So again, very different feel to Boehringer, and was there for sort of 2.5 years. I think doing various sort of roles, affiliates, regional, sort of increasing leadership responsibility, and then all of a sudden got approached. Well, actually, we were on holiday. We decided for the first time to go on a winter sun holiday as a family, and we went over to Cape Verde. And I said to Karen, I won't take my mobile with me. This is family time. Snuck my mobile in. Got approached by a recruiter who said, "Look, we've got this interesting role. Would you like to have a discussion about it?" And it was a UK headquartered rare disease company that was private equity backed. So again, very different from what I previously worked in. And they were looking for a general counsel. And had a chat with them, and they were going through a really interesting phase at that time where they'd got some drugs that were about to get approved in rare diseases, one which treated something called pediatric neuroblastoma. So it's a rare childhood cancer, which at that point in time, there was no licensed immunotherapy available. And I thought, gosh, this is quite special. I mean, they're probably, I don't know, if you look at, let's say, the EU4 in the UK, probably about 40 or 50 patients in sort of each territory. So, it's quite a rare disease, but it is absolutely devastating for the parents, because these kids and their parents, families, go through a traumatic experience of, once they get diagnosed, they go through radiotherapy, chemotherapy, surgery, other medical treatment. They have to be hospitalized for weeks. And I thought, this is actually really making a difference. I'm not saying that if you produce a medicine for hypertension, it's not making a difference. But for me, I could actually visualize the tangible difference it would make to those kids and to their parents. It's the difference between a father being able to walk his daughter up the aisle at some point, or not being able to. And I thought, I want to be a part of that. So that was
very, 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 very meaningful. And actually, there's a through line here for me in how you kind of relate to the opportunities in front of you, or rather what you're being called into, where there is this desire to have that very personal impact. It's like, how can I get to the thing that's going to have the greatest impact, in a way? Even the way you were describing how you're deciding where to specialize, it's like this, and then what part of that? It's like, well, this is the thing where I can feel the greatest, kind of human impact, connection to what's meaningful to other people, something like that.
Yeah. So that definitely plays a dominant part in my decision making. I think the other part that I've increasingly become self-aware of is time and running out of time. And actually, when I'm 80 and my son hates me using this phrase, shuffling off this mortal coil, what will I look back and say I've done? What have I achieved? What is my legacy? Have I made an impact? Have I made a difference? And I think that's something that is really important to me. It's about that purpose. It's about being impact driven. It's, I don't just want to be part of the cog that is slowly turning. I want to actually see the end results.
Yeah, I really get that, Dev. And I think it's so meaningful. And I think lots of people can relate to that. And where, those aren't just nice words. It's something that's very deeply held. And it's like, if I'm not experiencing that, if I'm not getting that sense of that through what I'm doing, then I need to be finding something else or some other way to do it, because it is so important, right?
Yep.
To have that. It's such a motivator. So you're in the now VC-backed business as general counsel.
Private equity backed, but yes.
Private equity backed. And then do you see that through to what? To some kind of
through to an
exit?
Yeah. So I was there for 6 years. Bizarrely, we exited during COVID. So there was a sort of paucity on M&A transactions at that point in time, but it just so happened that we were successful and we got acquired by Recordati, who were an Italian listed specialty pharma company. I say specialty pharma, actually, they've got rare disease, they've got a conventional pharma outfit as well. And what I found quite unusual at the time was we never actually got to meet them face to face until after the transaction concluded, which I thought was just, very much reminiscent of the strange times that we've lived in, during COVID.
Right.
So, whereas you'd normally be pressing the flesh and, meeting with people face to face and, going out for lunches and dinner, that didn't happen. It was all done virtually, on video calls. But it was very successful. I stayed on with them. They asked me to stay on. I stayed on with them for 9 months. And then I said, look, I think, once we've gone through the integration period, it's time for a new challenge for me. So I decided that I would leave. And since then I've been, I sit on the board of a couple of UK medical device and technology companies. I'm also partner in VC funds and advise a number of private equity firms as well. So I've been sort of keeping my hands busy and have recently set up.
The VC fund is Nadenza.
That's Nadenza. Yeah.
Nadenza, right? And that's
right.
how.
Yeah.
and that was just a kind of a fun thing. So Nadenza was it founded by Brian and his son, or
It was
Brian
founded,
foremost, and then
yeah, it was founded by Brown and his son,
and
and
Ross? Yeah,
yeah, and since it's founded just over a year ago, and since then we've managed to do three deals, two UK based, one US based, and we're diligencing some other companies at the moment. So it's going really well. It is slightly more time consuming than I think we all imagined, but that's probably not a surprise. I think we were being unrealistic to think, well, this is just a little hobby, a little side hustle.
oh yeah, we can do this 1 or 2 days a
We
week, no problem.
Correct, correct. What has been really interesting for me, though, having done it, is just the sheer volume of innovative technology that exists, certainly in the UK, but obviously more broader. And it concerns me that actually, as a country, we don't necessarily have the capital to deploy to get a lot of this groundbreaking technology up and running and through to commercialization. And this is amazing technology that's coming all over from the lengths and breadths of from the country, sorry, say from
Mm.
Imperial, Oxbridge, Edinburgh, Manchester, all over, and I just think it's a real shame because what we don't lack in this country is innovation, creativity, and intellectual
Yeah.
prowess.
Well, I'm going to come back to that, Dev. I want to get deep into all of that. But the reason I was picking up on Nadenza obviously is because you introduced me to Brian, and really this has been my kind of discovery of life sciences this last kind of year or so, uh, and then Brian and I have created a program
Yes.
really kind of leveraging his know-how to develop CEOs in that space. And then you're also involved with a CRO, so that would be a
Yes.
contract
So
research organization.
yeah, we're not a sort of traditional CRO in the sense. So this is a company called NWEH, and they're based over in Manchester. And what they've developed is proprietary algorithms and software that can identify patients. So if you were a typical pharmaceutical company, so look, I'm conducting a trial for smokers who are aged between 50 and 60 who've got hypertension. Traditionally, a CRO would have to go out and would spend weeks trying to actually get to identify those patients, and then you'd go through the painful process of consenting them to see if they wanted to come on board the trial. We can actually, or the company can do that in a matter of minutes using its software, so they can actually pinpoint down where these patients are. Now, from a personal perspective, from a pharmaceutical company, that's great, because if you can shave weeks or months off getting your trial up and running and then getting it through to completion, you can get your regulatory filing in. And if it's a blockbuster drug, even if you've shaved off 3 months in that time frame, that's hundreds of millions potentially of revenue that you're saving.
Yeah, that's a huge development, and so just to kind of, because to be quite honest with you, it wasn't so long ago that if you had used any of these words, I'd have no idea what you were talking about. So, CRO, uh, contract research
Contract research,
organization. So traditionally, the point of a CRO is that they are these early stage discoveries, sciences, businesses, etc. They will take their clinical trial to the CRO who can run that trial for them, essentially. Correct. Who can also do things like process data, etc. Maybe help them with other things as well.
And you're absolutely right on that last point, because I think now they've diversified, so they can do a little bit more than, well, not a little more, they can do more than what was traditional offering years ago.
So, and then the point of that, of course, is the CRO has got the benefit of scale. They can do lots of clinical trials. So I'm a small business starting with my new science discovery, and for much less cost, I can take it to the CRO to run that clinical trial, those clinical trials.
Correct. Yeah, and the CRO might typically employ, an army of nurses, boots on the ground, that can go and physically consent the patients, take the blood, do whatever. Yeah. So, it means as a small organization, as certainly if you're a startup or even if you're a mid-cap pharma organization, you're not having to necessarily capitalize it to employ all of those people to do it, because, clinical trials are notoriously expensive.
The slightly random analogy that came to my mind this morning was, I want to get my car washed. I could build a car wash at home, and that's going to cost me a lot of money. or I can take it to the car wash and get it washed. It's like,
Correct.
because
It's exactly the same principle. Exactly the same.
yeah,
Yeah.
yeah. Um, so okay, so Dave, I want to dive into all the life sciences side of things, but just looking at that really interesting trajectory, and going through kind of three, four very distinct cycles of professional career, changing lanes. Um, what what have been the kind of one or two through lines for you in that? What have been the kind of maybe either core principles or indeed sort of key learnings that you've taken away?
I think so. You touched upon authenticity, and I think that's pervasive through, for me, whatever career you do, whatever you decide to do, be authentic, be true to yourself, be true to other people. I think that's really important. The other overwhelming principle, I think, is don't stop learning. Learn from everyone around you, and it doesn't matter what level they're at. I've worked with some incredible people over the years. Some people who I might have been in the executive team and they've been L-3, but I've learned so much from them, and I take my hat off to those individuals. So I think don't be too proud in terms of your title and the position that you're in to think that you know it all. You don't. And the world's evolving and the landscape's evolving. So as long as you're open and you have that thirst and hunger for knowledge, then I think that will help guide your career and your success. And I think
Yes.
lastly,
Sorry,
sorry,
I was gonna frame that. There's a humility to that actually. So authenticity, and then there's a humility in that willingness or openness to learn.
I mean, I don't know everything. I certainly don't know everything. I know very little, in fact. I think, but you surround yourself by people who know a lot, and to a degree, it's how can you gel as a team, and I think it's that team dynamics as well that's really important to me. So for my team, I'm thinking back here now to use Pharma. They were really important for me, and it was about developing them as well. It wasn't just about how can I make sure that they meet their goals and their objectives, and how can I make sure that the corporate objectives are all ticked off and everyone does well and we get a nice bonus. It was like, hey, what do you want next? What do you want from your career? The succession planning, how can I make sure that in 3 years you're sitting in my seat right now? And that for me is a mark of I've done my job well, and again back to the impact that you have.
I love that, Dave. I really love that idea. And again, I think that's one of those things that probably lots of people can say, like, I like that idea, but probably maybe not everyone is really doing it because they might have, very human concerns about, I don't want to make myself redundant, I want to hang on to my position, etc. But in a way, your career path has been a statement of, I'm going to keep changing. I'm going to be moving on to the next thing. So there's a kind of confidence and conviction in like, so we need to get the next people ready to step into where I'm at because I'm moving on.
I'm expendable. We all
Yeah.
are. And actually, whenever I look at something, I know I'm not going to be doing it for the next 20 odd years. I'm really not, because that won't give me the personal satisfaction and pride. And I know that actually I won't be doing the company due service because I have got a limited lifespan in terms of what I can give to the company. So it's about getting the next generation primed and ready.
So okay, so authenticity, the learning, which I also framed as there's a humility in that as well, and then the bringing people up and kind of working to make yourself redundant to some extent, something like that.
Yeah. And when I hear you say it that way, you think, "Gosh, is that what I'm working to make myself redundant?" But actually, yeah, I mean, to a degree, yes, it is. I think it's back to why are you doing this? It's the purpose.
Mm-hmm.
It's purpose driven, I think.
Yes,
and I think
that go on.
sorry. No, I was going to say, and probably the final thing is, and this was a massive learning for me, it's learning to say no. I think I was a bit of a people pleaser, and it came back in feedback from one of my CEOs who I reported into, and said, Dev, you really can learn not to get involved in projects or to just say, no, I'm not going to do it. I'm either not going to add value or find someone else to do it. So you don't have to say yes all the time. And I thought, you're right, but it's quite a hard thing to do.
And what was it that was hard? What was driving the needing to say yes?
I think several elements. I think, predominantly I quite like problem solving. I quite, my wife often says this to me, and she's like, if she's had a rubbish day at work, she'll come in and she'll say, I can't believe it. I spoke to Annabelle today, and Annabelle said that. And I'm like, well, what you need to do is, and she's like, A, you don't know Annabelle. B, you don't know, I'm just offloading. She's like, you don't have to solve it. I'm like, okay, yeah. But I think so there's that problem solving element. But I think the other aspect is as well is you want to be that team player. You want to be seen to be someone that's approachable, you can go to, that will help. And that's fine to a degree, but it took me a long time to realize if you're doing that, it comes at a sacrifice. What is that sacrifice? Now, it's either going to be your own work's not getting done, or it's going to be personal sacrifice because you're not spending time at home with, your loved ones, because you're coming home and you're then doing the work that you should have done during the day. So that was an eye opener. But it was so powerful for me to have my line manager, have the CEO say that, because that for me is, okay, I can say no. That's an endorsement.
It gave you permission.
It gave me permission. It gave me the authority to be able to say no. And I'm not sure I would have had the confidence to do it without that.
Do you know, this really reminds me of, there's a very particular piece of work that I do with teams, and it's very much about that. And the way I frame it is, it's part of the need to be able to continually assess what is most important. And that can speak to personally as well as professionally. They're interconnected.
Yeah, yeah.
And that ability to focus attention on the thing that's most important, which means a willingness to be able to defer or let go the thing that is less important. And that isn't easy when everything's saying, I'm important. It's coming that this is important. It's like being able to make very sort of strong calls, really. And then you need to have the boss giving you permission to do that. It's no good saying to someone, hey, just choose what's most important. It's like, well, I did. And then that was actually different to what my boss thought was most important.
Absolutely.
Okay, now you've just shot yourself in the foot.
Correct. So, and on that point as well, I think the other aspect that springs to mind is the disappointing other people. So when you said, stop doing things that aren't important, well, they're important to someone. So, if I've got 5 things going on and 4 of them I prioritize, how do I say to the 5th person, well, actually, your project is not important to me? It's really important to them. It might be their number 1 priority and objective. So how do I let them down gently, or how do I help them understand that it may not be right now the fundamental focus on corporate strategy? So that was a massive learning for me as well. And it was, how do I maintain the equity in that relationship, but still not do what it is that they want me to do?
Yes. Yeah, really, really key learning, and nuanced, and so nuanced, because in some situations it's going to be a case of you've got to manage it really carefully. In other situations, it's probably just going to be, that's just a clear no, and we don't have the time or space to get into me going through that very in detail with you. It's just like, it's so variable, right? And so being able to navigate that is...
It really is. And the different companies that I've worked at and the different boards that I've sat on, and actually the default position, and actually the easiest position, is we don't have the money to do it. And that's really easy, because if you say we don't have the money to do it, no one can criticize you. It's not a personal thing, which is we don't have the finances to do it. But as soon as you say we can't do it because it's not a major priority for the company right now, it becomes slightly personal for people.
Of course. Yeah. Well, look, Dev, there's so much we could get into there, but I'm going to keep us on track with our plans. So I really want to get into the life sciences side of things. I just want to ask a really simple question first, because this was a question that was in my mind when I first was kind of discovering about life sciences. Is, what are life sciences? What are the sectors? How would you sketch that out for people?
Not sure I know. So for me, when I think about life sciences, I think about biology and chemistry interacting, and physics interacting and technology in a sort of on a human form. And actually, I say human, I'm focusing on humans, but it's also veterinary as well.
Mm.
So for me, typically, I would look at pharmaceuticals, so pharmaceutical drugs, discovery. I would look at medical devices, so implantable devices. I'd look at medical technology as well, so X-rays, MRIs, CT scans, ultrasound scans. So I think predominantly that is what I would construe
Mm.
to be life
So
sciences.
we got drugs, making drugs basically, um, and then we've got making things, devices,
Devices, and
which
then
obviously includes tech. And
yeah,
then
diagnostics.
there's this slightly confusing term I found, which is called biotech, but that would be more like uh,
But biotech,
playing with the organism itself.
correct. So you're using a living organism or cell in some way, shape, or form.
Yeah, and then that's where you get into things like genome stuff and
Correct. Yeah,
this kind of
yeah.
thing. Yeah,
And the other aspect as well is the diagnostics.
and
So
diagnostics. Yeah,
yeah,
and then within all of that, you've got the kind of core uh, businesses that we've just described, but then we've got all the sort of services and suppliers that support those businesses that are all
it's
part of this thing called life sciences.
it's a very rich ecosystem in that
Yeah,
you've got the traditional players that are commercializing the drugs, you've got drug discovery, you've got drug development, you've got the ancillary services, so you'd have pricing and reimbursement, market access services as well. You've got, I hate the term sort of support staff, but you've got the G&A functions as well. You've got finance, legal, HR. You've got all of it. I mean, as you would
sure.
with any corporation, you're dealing fundamentally with people. So you've got to have an HR function. You've got to have someone that's capable of paying the bills and looking at the cash flow, and you've got to have legal support. So it is a very rich and varied tapestry.
And then the other part of it for me is just to kind of maybe it's just stating the obvious, but I think for the layperson maybe it's very easy to just fall into the mindset of there's something a bit nefarious about big pharma, and maybe there is, right? I mean, there's plenty that we probably would want to change, and people talk about the sort of industrial pharmaceutical complex that people talk about that in relation to America as well as and other geographies as well, and that there are things that have got totally out of whack. But I think, in terms of the context of our conversation, really just wanting to land how important and meaningful the sector is actually, and you've been speaking to that in terms of your career trajectory and what was informing your choices. But we're talking about things that are just making so much difference to people's lives, and it's moving fast, and we don't always appreciate how much we're benefiting day to day, from the kind of developments and advances that are being produced in this sector. And then when it comes to really critical moments, crisis moments, health crisis, um, emergency, etc., where we get to benefit from this extraordinary pace of development in this sector. Like it's so important, it's so meaningful. And I'm not trying to discount the things that we might go, well, we need to do better there, or the sector needs to change, or do you kind of get what I'm speaking to here?
I do, and it resonates well with me. And I think actually one of the decision making points in time came when I was working as a clinician in Oxford, and I used to sit on the reproductive ethics committee, and the more say controversial, but some of the more challenging cases would get referred to us, and we consisted of clinicians, nurses. There was a vicar from Oxford University Chapel, or one of the college chapels. There were some ethicists, there were some lawyers, and there was a case in principle that got referred to us that really made me sort of question, exactly to your point, the interface between law, ethics, and science. And it was a lady who was awaiting a heart-lung transplant, and she wanted to start a family. And the only way that she'd be able to do that, because of gynecological issues, was through IVF. And as clinicians, our natural reaction was absolutely not. It's far too risky. So not gonna do it. There's a danger to her and to her unborn child. And the ethicists and lawyers approached it very differently and said, well, look, providing she is compos mentis fully consented and is fully aware of the risks, it's her decision. Why are you being paternalistic and making that decision for her? So to your point, it was, well, how do the three interact? Because law always plays catch up. Technology is streets ahead. Law is playing catch up. Law is just a visceral reaction from the public and from parliamentarians. So how do things work? Because technology is always going to, you'll remember, was it 2000, Dolly the sheep and, cloning. So, the technology is there. Should we use it? Can we use it? Why shouldn't we? So I think that for me is the interesting thing. I mean, we know now, with the analysis of the genome by Cambridge, with, what we can do with genetic manipulation, with CRISPR technology, there's a huge amount we could do. But the question is, should we do it? Because we can.
Yeah.
And that to me is fascinating. I don't know the answer to that. And, I think very differently now to how I thought 10 years ago, to how I thought when I was 20, to how I thought when I was at school with you.
Interesting. Yeah. And it's really on us at the moment, this, isn't it? In not just in life sciences, but, the technological advances in all different sectors, AI, etc.
Yeah.
Very, very, very big questions there. And again, probably a much longer conversation. The other factor, of course, is commerce as well, isn't it? And how that interacts with those different perspectives and motivations. And that I kind of want to get into some of that. And maybe particularly, let's look at it like this. From a UK perspective, specifically, if you were to paint a vision of success for the UK, because you hinted earlier about we've got really quite extraordinary depth of sort of scientific insight and know-how and talent, etc., discovery. We really do have something quite extraordinary in the UK in that regard. And there's this sort of, I think, a general sense of we're not able to leverage that. There's something not quite working. And I'd be interested, Dev, not so much what's needed to make it work, but if you assume that we have provided what's needed to make it work, so we've made it work, we've been able to really leverage all of that talent and potential. What's the vision of success? What does that look like? If we're being really successful at maximizing our potential, what does that look like in the UK? What's happening?
So
what are we seeing?
For me, it's how do we leverage all of that talent, all of that know-how, all of that innovation. Now, part of the problem is, and I know you said, don't come up with a solution for it, but I think part of it is we just don't capitalize it well. We don't incentivize, we don't fund it properly.
So I want to come back to that, but first of all, let's say we've got the capitalization right.
Yeah.
We've money's poured in to the places it needs to pour in, and so these discoveries, innovations, etc. They're coming to market. They're being successful. What does that actually look like on the ground in the UK? What's different to what we're experiencing now? Why is that a good thing? Why are we going, hey, fantastic, it's so good we've done that? What are we looking at in the UK that's now different if we're being successful like that?
The ecosystem since, without getting political about it and wanting to depoliticize this answer, is, ever since Brexit, we've not really been as attractive as a place to do things like clinical trials. Let's say for life sciences, you would go and do it over in Europe. There are a lot of European countries where they've got very well curated data, and it makes sense to do it there. I think equally, what success then looks like for me is how do we attract some of that clinical trial networks back into the UK? How do we start to produce more drugs? How can we get our manufacturing up? So it is that whole tapestry again of the life science ecosystem.
Yeah, so I think that's kind of where I was leading you. I think is we look around and we go, wow, we're just doing more in the UK. We're running clinical trials. We're making things. We're manufacturing things. And then all the supporting the ecosystem effect around that. So then we've got people marketing, we've got people, we've got people providing coffee and lunches for the people who are doing those things.
It's the whole thing.
It just becomes an amazingly ripple effect of economic benefit. It's like, and I love you actually said this to me the other day, Dev. You went, we could have a manufacturing boom, and I thought, well, that's such a interesting way of putting it, because I never really, in my layman's mindset, equated life sciences with a manufacturing boom. You say manufacturing, I go, oh, cars, something like that, right?
Yeah.
And it's like, yeah, okay, but actually life sciences could be a manufacturing boom for the UK.
100%. And, I know we're going to come back to this, but the technology that we're capable of deploying lends itself to us being able to manufacture on a large scale. Now, okay, this isn't a good comment, but I fully appreciate that if you're looking at it from an economic perspective, it costs more to manufacture here than it does, say, over in India or China. And where you're looking from an economic perspective, there will be decisions that are taken, which are, well, we're not doing it in the UK or Europe because it just costs too much. However, to your point, the knock-on effect of what it does and generates for that community where the manufacturing is based, and, typically look at Ireland and look at what's happened in Ireland with pharmaceutical manufacturing. It's a huge benefit to that community. It's a huge benefit. So for me, that initial investment will only reap dividends downstream. Now, I'm taking out the political aspects of, let's say tariffs and, the two T's, the Trumps and tariffs perspective. Economically, politically, things can change. And you just have to navigate those waters, as you see fit during those particular periods. But the effects on the community, if you want to regenerate communities, invest in manufacturing, because everyone will benefit. You think about
I love that. Go on.
No, I think it was AstraZeneca that we're going to invest. I can't remember. It was 200 million over in Liverpool, and then they pulled that because of the tax implications from Rachel Reeves. So
well, I think it's always helpful to first of all understand where are we trying to get to? Like, what's the vision here? What's the destination, and why is that compelling? What's exciting about that? What are the benefits? What's the motivation? And then there are lots of ways to figure out, okay, how do we get there? But I think in some ways we get very caught up in the how, and particularly in the life sciences, like, oh, we need to do this, we need to do that. It's like, okay, but can we just keep reminding ourselves why?
Why?
What it like every what's the win here?
What's and why?
There's a really big win of kind of rippling effects and accumulative effects, and you see that even just going to the Oxford Science Park last week. Just go, to put it bluntly, like, shit's happening here. Whether that's like because we're building an office. It's like, okay, that's construction, or because, all of those economic effects.
Let me throw the question back to you, because the Oxford Science Park, Business Park, is a very good example. So again, back to my earlier point, there is all of this creativity, innovation in the UK, but there seems to be a hurdle or a block to actually get it to the latter stages. Why is that happening? Is it purely funding?
Well, so I was talking to someone at one of the businesses in Oxford Science Park, and they've been in their particular business for quite some time now, and they said, as much as anything, it's a mindset. There's like this mindset that somehow we can't do it, that we're a little risk averse, that we're we don't have the it's like they really were saying there's a mindset shift that's needed, where we kind of got to see ourselves as being the people that can do it, that do it, that where we can be risk aggressive, all of that. Does that? I mean, you would know more than me, Dev.
That resonates, and actually, I often think when I've sort of debated this that we're a little bit of a sleeping giant. We have the foundation But to your point, there's that risk aversion that we have, which is you don't typically see over in the US, and you certainly don't see over in China, who are far more bullish in their
Yeah.
approaches and their attitude. I think we still have that sort of European mindset, where we are a little bit more risk averse. That
And
risk benefit profile plays out.
and yet we're so curious, and
Yeah,
so many people are creating these incredible discoveries just out of that sheer kind of curiosity and sort of intellectual drive and ambition. But then when it comes to, okay, now let's leverage this, let's make it big,
yeah, yeah, yeah.
There's a sort of missing piece, and maybe that risk aversion. I think, my observation is that the world does reward risk tolerance. It rewards the willingness to take risk, and even if you
Absolutely.
look at your career trajectory, like if you didn't have risk tolerance, you wouldn't have been able to make those transitions. But something inside of you got comfortable with, yeah, I'm taking a swing here. I'm gonna do something that's got some risk attached to it.
It's a really interesting concept because if I look at it from a personal perspective, and I look at let's say my family, so I look at Karen and Amelia, and they are naturally risk averse. Naturally risk averse. They will play it safe the whole time. If I look at the boys, caution to the winds, gung ho. which again, not going down the sort of gender stereotypes here, but they are
Yeah,
naturally just very different in their approach. So I was sort of saying to Amelia, well, why didn't you? I think she was invited to go on a trip to Berlin at Christmas time, and as part of school. And so, well, why don't you go? She said, oh, I'd be really tired, Daddy. I'd be really tired. So, an amazing experience for you. But you go to do something slightly different. Oh, Daddy, I'm not sure. I'd just be tired. And Harry's going. He's like, yeah, great.
going on.
So
Yeah,
I think that sort of that risk plays massively into what defines us as a country, and I think we've got to be able to take it to the next level if we want to get these amazing ideas and innovations through to commercialization, at which, back to the earlier point in time, and which will have a knock-on effect to the whole community.
yeah, and what a great moment to be doing this. And again, I'm not just trying to talk talk up the book, but I just genuinely, again, like this is all quite new to me. Like I've this sort of exploration into this sector and discovering more about it. But it's really clear that obviously the UK is saying we've got to grow, we need growth, more than ever. It's a really important moment for us. And then life sciences provides a tremendous opportunity for that. And at the same time, there's this, what I sense is this sort of pivot moment in sciences globally where the breakthroughs are happening so fast.
Yeah,
It's like the advances are so rapid and it's only speeding up. So there's this tremendous opportunity to kind of bring all of that together and go, you know what, this could be one of the jewels in our crown, and let's really get behind it.
but it's gonna require the government to incentivize manufacturers and developers in order to make that come to fruition. Because fundamentally, if you don't create an ecosystem and an environment that's conducive to manufacturers wanting to capitalize and invest in your country, they're not going to do it. So if there's
So
an option,
let's do some nuts. Let's do some sort of detail around that, and then I want to come back to just touch on tariffs and the kind of whole, the kind of regional competition as well. But just in terms of like making the environment in the UK attractive, what does that mean? Would you say, like, what if you were just to give the headlines? What are the key pieces there?
so look, again, these are just my views. I would have tax breaks for. I'm going to focus on life sciences. I would have tax
Go for it.
breaks for life sciences companies. So reduction in corporation tax. Going to your earlier point in terms of the innovation and the human and societal impact that life sciences companies can play, I think that's unquestionable. Where there needs to be a balance, however, and this is a slightly different perspective, is just making sure that the pricing and reimbursement is fair and equitable. Because what you do see with some companies is they will massively conflate the prices in terms of, this is the price that we're setting. And you think, well, it didn't cost you that much to develop
Mm-hmm.
your drug. So, this is.
So there's got to be some reciprocal um, sort of give and take with
That does.
essentially the government that is supporting you. There needs to be some, or the consumer really is supporting you,
Yeah,
the
absolutely. And I
taxpayer.
absolutely hate that word in life sciences. So, and not not to dig at you, but consumer to me, as an ex-medic, a consumer. I don't think of my
Yeah.
patients as a consumer, but actually, you're right. Fundamentally, patients are consumers. They're consumers of products
Well, but and I was thinking about it more broadly, actually, like the taxpayer.
or
So
taxpayer. Yeah.
we're all taxpayers. Um, so
The,
if we're supporting you, then there needs to be some reciprocation there.
the first time that when I worked at Biogen and I went over to the US mothership over in Boston and spent 2 weeks out there, and remember staying in a hotel and going to the gym and sort of plugging myself in and watching the TV, and there was an advert that came on for a drug, and it wasn't a Biogen drug, but it was a sort of typical thing where you've got glamorous people and they all look really fit and healthy and wonderful, and then at the end of it you get the small print and you get the sort of and terms and conditions may apply at some breakneck speed, and I thought, gosh, it's just so different in the US where it's okay to monetize health.
Mm.
Actually, we look at it very differently, and I'm not saying their system is right or our system is
No,
wrong. I'm just it's
no,
just
sure, it's different. Yeah.
it's different, and it was really interesting for me because it made me think, okay, well, look, ultimately, to your point, patients are consumers, or taxpayers are the consumers of this. So how do we get the funding model right that's fair for everyone, that allows manufacturers to innovate, to create, to seep into the broader community in terms of the additional ancillary job perspectives, but also means that it's not a burden on the taxpayer.
And there is this, I think, immediately immediate difficulty in the messaging, and if this gets political too, which is that when you say, well, I would create tax breaks for essentially investors in life sciences in the UK, then immediately my mind goes to, yeah, but we're talking about tax breaks for very wealthy people. And I know that that's not what we're necessarily talking about, but it's
You're
very
right.
easy to then frame it in that context and go, well, we've got massive inequality, and we're now saying, hey, give the folks who have got all the money some tax breaks. And just to finish the thought, it's like, it's funny because I don't think we've done that in relation to, say, the film industry in the UK, where there have been incredible incentives and tax breaks, tax advantages to
Yeah,
invest in the film industry. And as a result, we've had this boom. I mean, it's maybe not right this second, but there has been this amazing boom in the film industry in the UK, with studios being built and massive employment, and we're a very attractive place. Big budget movies coming to the UK,
yeah.
great benefits for just so many, including tax revenues. But I don't think anyone's been going, well, hold on, you've created tax
Why are they?
benefits for the film.
Yeah,
Yeah.
yeah.
But I think it's very easy when we start, for some reason, we start talking about life sciences maybe, or other sectors.
But I think you make a really, really interesting and valid point, and that is, as soon as you start to differentiate and single a particular sector out, you leave yourself vulnerable to criticism. Because my counter argument would then be, okay, well, what are the two things that you need in life? Well, you need health and you need food. So what about the agricultural industry? Why are we not giving them tax breaks? In fact, right now, as under the current government, they've taken a bit of a hammering for CGT. So it becomes really difficult. But it's, how can I maximize growth and generation within this country? And I think one of the areas that we have is our health and tech sector, where we do naturally have a massive talent pool and we should capitalize it. And I'm not saying we shouldn't do it for agriculture, but I know this is a completely different conversation. But I think unless we start to look at things a little bit more microscopically and say, okay, well, let's drill down and see where can the growth come from, then we won't capitalize on our potential.
Yeah. Yeah. I mean, I don't envy the politicians trying to create the policies around this, because they are having to juggle seemingly competing agendas, and where obviously, to me, uh, morally, but both also in terms of productivity, you want to be taking care of people, and
Yeah, yeah,
which comes back to health and life sciences actually. But you want to, you can't have a world where it's like, and maybe the US is a little more like this, where there's just no safety net. It's like, and if you're not making it, it's your fault. I mean, I'm being making sort of sweeping
yeah.
generalizations, but like that
But
we need to be a society that is raising everybody up, and we're looking at distribution as much as we are looking at production, you know, production of wealth and then distribution of wealth. But
agreed.
you used Ireland as an example. I mean, Ireland, they created, they made themselves very attractive through the tax system
Corporation tax. Yeah.
for big business, and they're sitting on a mountain of cash as a result. And I don't think anyone in Ireland, I don't know, I'm totally talking about something I don't know about, but I don't get the impression people in Ireland are generally going, it's a terrible thing. It's very, this is
Yeah.
worked out badly for us. I don't think that at all.
Ireland's really interesting, and as I mentioned, Karen and I spent 3 very happy years living and working out there. But the only thing that wasn't great about it was at the time that the Irish rugby team were in their ascendancy, and we had Brian O'Driscoll, so it was a Brit over there for the Six Nations. It was terrible, but their healthcare system is very interesting because you either go completely private, you're part insurance funded and part state, or you're completely state. But there is a massive disparity in the level of care that you will get, not just in terms of the speed and access to diagnosis and treatment, but actually the level of care that you get. So having come over from the UK and having come over from the NHS, where I thought, typical sort of, oh gosh, it's terrible over here, we're good, but we're not that good. When we got there, I thought, actually, we're not that bad after all. So I don't know what the right answer is in how we determine globally, or in the UK, even on a smaller level, how to get this healthcare and drug funding where it should be. But what I do know is that we've got the talent pool, but something needs to fundamentally change, whether that's the funding, whether it's the bureaucracy, the regulatory system. Something needs to change to just get us ticking on a slightly higher gear.
So yeah, so funding, and then you like the regulatory. I think is interesting. I was listening to Peter Attia's podcast. He does The Drive, and he was talking with, oh, I can't remember the guy's name now. Anyway, they were looking at medical innovation, and he was making the observation that actually you need to double down on, in the initial stages of discovery. Yes, you want to be very strong on safety, but actually you then want to move when you're looking into kind of then building on that technology, that innovation, you then want to be doubling down on efficacy.
Yeah.
And what tends to happen is that they both get sort of smushed together, and everyone's very concerned about both all the way through the process. It's like, no, let's start with safety and focus on that regulator in the regulation, and then move to efficacy and take a little bit off of the safety because we've sort of ticked that box, or ticked it enough. And by the way, in that distribution, in that being able to scale up, we're going to find a lot out about the safety.
I would 100% agree with that. I don't think I could have described that better. I mean, the one thing I will say is that safety isn't a static point. There's longevity, it's longitudinal. So actually, you will be gathering safety data over a period of time. And actually, if there's safety signal that arises after 10 years, and you say you take a pill, and after 10 years you've got a tenfold increase of developing a certain cancer, then the regulators can intervene. But I would absolutely agree. The problem that we do is we smush everything together, as you say.
So we're not going to scale this until we're 1,000% certain on every possible safety scenario, and 1,000% certain on efficacy.
Sam, you will remember when we were children, if we had a cut or a graze or a headache, we would be given aspirin. Aspirin you cannot now, or it's contraindicated in children under 12 because it can cause a rare ear condition. But we took it, so it's sort of, I understand that I'm not questioning the need for safety because it all came from thalidomide. You absolutely need to have safety data, but every single medication that you take comes with a risk-benefit profile, a risk-reward. It's, what are you trying to achieve here? So you've got to be able to look at the two, yes, in continuum, but also individually. Once you've passed the safety, then move on to the efficacy. I don't want to fundamentally take a pill because it's safe. I want to take a pill because it's going to... I do want to take a pill because it's safe, by the way. But I want to take a pill because it's also going to do what it says on the tin.
Mm-hmm.
If it doesn't do that, and it doesn't, increase my longevity because it gets rid of my cancer, or it, stops my diabetes, whatever, then what's the point of me taking it?
Yeah.
It's got to be efficacy driven.
Yeah. Well, again, there's a lot there, Dev, but I think the overarching takeaway for me is that the UK has this absolute sort of rocket ship of a sector.
100%.
It's like, okay, how can we get this thing to launch? Because it's going to be so good. It's going to be so good for everyone. And like I say, I think potentially a jewel in the crown. And yes, there are some very difficult things and nuanced things to navigate, but there must be a way through that. There must be.
No,
Dev, I want to just quickly take us on to a few kind of more kind of geographic issues, geopolitical maybe. So first of all, just tariff insights. Just give us the headlines from your point of view. What does it mean for the UK life sciences, UK USA?
I think it's a wait and see, and I know that's not a great answer, but obviously Trump has come out.
It's the right answer.
The reality is we don't know what he's going to do, and it changes with the wind. So he's come out and he said that there are going to be tariffs on drugs. He wants more investment in the US. Huge number of major pharma players have said, we're increasing investments in the US. Merck, AbbVie, all big players, Eli Lilly, J&J, Amgen, just to name but a few, have said we're going to invest. What I will imagine is that there's going to be more manufacturing sites set up in the US so that they can get around that tariff issue. How does it affect us? Well, if I was at GSK, I would set up a site over in the US to manufacture my drugs right now. However, and the contrary view to that is, okay, well, look, let's maybe backtrack a little and say, how important is the US to the pharmaceutical industry?
Yes,
it's massive. You don't succeed unless you're in the US. I mean, you do, but it's the number one player. It's got the biggest industry, the biggest growth driver. So if you want to
back of a beer mat, what percentage of the global sector is the US market?
I couldn't even. I think it's probably only 40%. Okay. It's huge. But again, don't
Sure.
I'm guesstimating here. However, you can't ignore what's happening over in China. And this is where the tension comes in, because China is not only manufacturing a huge number of drugs, they're developing a huge number of drugs, and the pipeline and a huge number of Chinese pharmaceutical companies is incredible. So are they on a match, on a par with the US right now? No. Will they be shortly? Yes. So there is a massive tension. Question for me is, what does it do to Europe? Because traditionally it was US, Europe, Japan. They were your major players. India's got a massive pharmaceutical industry, but it tends to be more genericized. So it's a slightly different player in that respect. But now you've got China massively emerging as also a global player. I think the question you asked me previously was, who do you side with? I think my answer, now being political, is both. I don't think you can afford to ignore either one of them. Mm-hmm. What it does in terms of tariffs and economic growth, I don't know. I think you have to play strategically. I think, it may be that you end up moving some of your manufacturing to the US, but you also have relationships with China that maybe you supply rest of the world, or Asia Pac, or Europe from a China manufacturing site. So, can you strategically operate in both?
Yeah, so the supply chain becomes more localized.
Yeah.
But HQ would be, ideally, in an ideal world, UK discoveries get HQ'd in the UK.
In the UK. Yep. Absolutely. But then that almost feeds back into the previous point that we were talking about, which is taxes, which is how do you make it tax efficient so that people want to headquarter in the UK in terms of where do you put your IP? Where are your sales being generated from? Because if you start to take a slightly more disparate approach in terms of having sales from lots of different territories, then you run through different tax regimes.
Yeah.
So, these are, conversations and arguments and lines of reasoning that are far.
Well, I mean, I think life sciences is not unique here, where we're seeing this really fascinating to watch how quickly it's flipped from we must all decouple from China. That everyone must decouple from China. They're the risk to let's start building relationships with China.
Correct. 100% correct. Yeah, I mean, I can remember when we did a deal with it was actually a US Chinese company that was listed over in the US, Shanghai and Hong Kong. And the big question was, what will happen to your IP? If you partner and you out-license your drugs there, will you suddenly find that they're producing, cheaper generics of your product that they're then flooding the market? So that was a massive concern. Now the concern is not so much that. I mean, yes, it is still a concern, but that can happen anywhere. There are opportunities to be had with China. Manufacturing, the regulatory regime has got a lot more efficient, a lot more flexible, a lot faster. So getting a product to market in China, there are still, local and regional nuances in terms of price reimbursement, but actually getting a product to China now is far easier than it was several years ago.
That's so interesting. Actually, it relates to the film industry again for me when you're saying that experience of IP theft in China and the observation that, again, going back a few years, that the last place a production firm, a studio would release their movie would be China, because once you release it to China, the IP's gone. Like you no longer own it. so that's always the last one. But yeah, maybe that's changing. And then Dev, just touching on UK Europe, what would be your play for the UK Europe relationship with regard to life sciences?
I think it's just a broader one in general, which is, at the end of the day, they're our closest trading partner. I don't think we can distance ourselves from Europe. And if you want to, so if I was wanting to set up a company, a pharma company, and I wanted to headquarter it in the UK, the natural next step would be to have affiliates in Europe, because they're our closest trading partner. They share a pretty similar, if not identical, regulatory framework. Okay, you've got the regional and local differences of pricing and reimbursement, but once you go through that, that's where your core business is going to be. You then look to expand to the US, potentially China, Japan, the MENA region. If we ignore Europe, it will leave us behind in terms of the life sciences sector. However, I do think that Europe, or the EU in particular, shares similar challenges to the ones that we have as a nation, in terms of they've got to be more incentivization for companies, because we will regionally be left behind by the US and China if we don't actually focus on the sector and incentivize people. There's a lot of posturing in terms of ethically doing and saying the right thing, and I think to a degree that's fine, but actually, what are you trying to achieve? To your earlier point, what is a what and what is the why that you're trying to achieve?
I've always rather felt that there is a distinction between trade and ethics, and of course it rapidly gets complicated. I get it, but I think we've tended to overconflate the two. Actually, like I think you can have a trading line and an ethical stance or policy. I think they can be kept a little more separate. I mean, I'm making sweeping statements here, but
no,
very simplistic, But okay, so yeah, interesting. And of course, this is all, we're talking life sciences, but this is all macro stuff as well, isn't it? It's every sector,
everything. I mean, the one sector that I look at that I think actually faces more challenges than the life sciences is the automobile industry. It's car manufacturing. I mean, if you look at EVs and, what China are currently doing, you start to think, wow, what's going to happen to the European car industry? I think to a certain degree, the UK is slightly protected from it because actually we don't produce that many cars anymore. What we tend to do is the high-end vehicles, So, if you're into the Aston Martins, and I think, you're absolutely fundamentally fine, or the Bentleys. But I think, from a sort of, more general automobile industry, there is a lot of pressure that Europe's going to be facing.
Yeah. Yeah. Well, Dave, just one last topic I want to touch on, because I think it's really relevant to where your focus is, and it's an important area, which is women's health. So, of course, that's been a through line from in terms of where your medical career started, but it's now also come to the fore in terms of where you're putting focus and attention as I think an investor and business builder, etc. So can you just say a little bit about that? I mean, the stat that I think I recall you mentioning before was that 2% of investment in the pharma sector goes into women's health. So just 2%, which was pretty...
Into development, yeah, absolutely.
Development.
And that was a conference that I was recently at. And it's astonishing when you think, again, to generalize, 50% of the world are female. So, why is it 2% that's dedicated to women's health? And I think that's multifactorial. I think one of the biggest problems for me is, what is women's health? How do you define it? Because it's typically been defined by, well, it's either your ability to have children, so it's fertility, or it's your ability to not have children, so it's contraception is under your control, or it's your ability that you can't have children any longer, so it's the menopause. So it's sort of it's quite pigeonholed, whereas I think we can all say what men's health is. Really interesting fact that I discovered yesterday was, and I'm just looking at it now to make sure I've got this right, 2024 World Economic Forum found that in startups from 2019 to 2023, addressing startups that were looking at endometriosis, which is a gynecological condition where you get bits of essentially uterine tissue deposited elsewhere, and it's very, very painful, debilitating. So, a lot of women have to take a lot of time off work, and it can take years to diagnose. So in that period, so that 4-year period, startups raised $44 million worldwide. During the same period, erectile dysfunction raised $1.24 billion. So there was a massive disparity. And you sort of think, okay, I'm not dismissing erectile dysfunction for 1 minute, but I'm saying that the two are very, very different in terms of the impacts that they have.
Well, different in terms of impact. What in terms of scale of? I mean, it's the wrong word, but scale of market. Like how many men do we know are being affected by erectile dysfunction versus how many women are being affected by? I'm going to get the say it for me. Yeah. Endometriosis.
Yeah.
Do we? Are they equivalent numbers? Do you think?
I would imagine there are probably more women that have endometriosis, because one of the problems with diagnostics is it takes a long time. So there are a lot of women that will have endometriosis that don't actually know they've got it because they've not been formally diagnosed.
And then when you consider, as you say, the impact of having endometriosis, where that may require, time off work as well as all the other
surgery, infertility treatment. So, it's possible. And as I said, this isn't to in any way compare the two. This isn't,
No, and it's not to minimize the effects of men going through erectile dysfunction,
Correct.
where there may be all kind of,
Correct.
Secondary negative impacts that are very significant. But that's just a fascinating stat. What was it? It was 44 million versus
44 versus 1.24 billion.
Amazing.
I mean, it's astonishing. It's absolutely astonishing. And I think, I think what is encouraging and edifying is that there's more discussion about it. I mean, the fact that we've got, two, if I can say it, middle-aged men sat here discussing women's health is a good thing.
Mm-hmm.
And it is now not so taboo. I mean, we'll all remember the days when, the sanitary products were advertised on TV and, they wouldn't use a red dye. It would be blue. And I'm like, well, why? Why is there this taboo about women's health. You don't have a taboo about men's health. You don't have a taboo, for example, about erectile dysfunction. Pele famously did the adverts for erectile dysfunction. So you've got a great celebrity there. You've got a well-known star. So why are we not having the same discussion about women's health? So there's multifactorial. I think that's going to change. What we're seeing now are more women in positions of leadership in companies that are starting their own companies, that are focused on femtech, that are focused on addressing the disparity and inequality. That can only be a good thing. The other issue for me is that we need to invest more in women's health, because if you start to take a step back and think about the population that we're identifying here, and I don't want to stereotype here, but women traditionally have the roles of workers, carers, caregivers. So they are playing a slightly broader, if you take that view, they are playing a slightly broader role than perhaps some men are. So, we are typically defined by our careers. Sam, what do you do? Dev, what do you do? That's us. Whereas actually, Karen, you're doing the school drop-offs, you're looking after your parents, you're doing whatever. So the impact of their health, not addressing those, means that it actually affects a broader population than perhaps you and I being off sick for a while.
Yeah, I mean, I guess I wonder if that kind of cliche is changing.
It is.
It is. And so I think you can make the argument that women's health. There's if we're just going to break it down to kind of bottom line economic impacts, that women's health has a massive part to play in terms of productivity of the nation, just in terms of, like you say, time off work, as an example, or having to move out of work. But then also, like you say, there are a lot of other areas of impact too, in terms of family and etc. Yeah, no, I'm a little bit blown away, I must say. I did that comparison you made between the men's and women's health investment is just extraordinary. So Dev, what are you doing to move the dial here?
So So one of the companies that I'm a board member of, starting a women's health initiative, and we want to engage with industry players in the Northwest initially, and then nationally, and we want to basically put this on the map, on the agenda. We want to start discussing it, and we want to see what pharma can do to also pharmaceutical companies can do to invest in women's health, to actually focus on women's health, and actually just start the dialogue in general. So I think making sure that everyone is aware of the effects of women's health conditions and what impact that plays. So we're talking about the fact that it might affect family dynamics, because, if your wife isn't able to do the drop-off or look after the parents or look after whatever, how does that impact everyone around you? It's also about getting women into clinical trials. It's typically, clinical trials can be very difficult for women to enter, and don't typically target women, by the way, because, again, all the reasons that I've said, if you've got to do the school run, well, I can't be over in a hospital being consented or, having blood tests done. I can't go in midday because I've got other commitments that I need to factor. So how can we open up, level out clinical trial recruitment to make sure that we get women coming through as well? Because it is typically skewed towards male patients coming in.
And then presumably, pushing investment into sort of early stage businesses as well that are focused on
very much, which actually is beginning to happen, which is very satisfying to see. There is more investment now that's being plumbed in. From an economic perspective, there's a huge amount of growth potential in women's health. It's been underinvested, and I think companies are to realise that now. But I think it's, for me, about talking about it at a more macro level and just making sure that people are aware. The one thing that we all have are mothers. You may have a sister, you may have a daughter, but we all have mothers. So it affects someone in your family. And it's about realizing that. And it's about, I think, for us as well as men, not being uncomfortable talking about women's health. I mean, I know for sort of you and I in the sort of, 80s at school, it was a taboo subject. It's like, we discuss that.
Well, you and I went to like exclusively boys' schools until we were 18. Isn't that
Correct.
right? Yeah. I mean,
Yeah,
I was putting you in that bracket too, but I think that is true for both of us, right? So,
it is. It is very
um,
much so. So for us, girls were sort of creatures of admiration, fascination that we met, during out of school hours. But it's about just realizing that we all work with women, we all know women. They shouldn't be treated differently. They should be invested in from a health perspective, just in the same way that we fund other health areas.
well, look, Dave, there's some real. I mean, we've talked about we've gone into some big topics here, and each one of these topics, I think we could have gone into in even more depth and longer. So maybe there's another conversation to have here. Maybe we can do this some more. But before we end, what are the three things that you're going to be doing next to be kind of moving the dial on these things that are important to you, on this domain that you're very invested in? What would you say
So
the kind of key three things are for you?
yeah, so I think the first thing is in the process of establishing another rare disease an oncology company, and that's something that's important to me because rare disease is an underserviced area. There are about 8,000 rare diseases, of which about we can treat about 1,000 of them. So that
Mm-hmm.
patients and their families, and let's not minimize the impact on the families and carers. It's a hugely underserviced market, and I think that's something that we need to focus on. So for me, that's something that is a key priority. The second is women's health initiative. So that's something that I'll be doing with at the sort of board level, but also just wanting to see that gain more traction, more momentum. It started that there was under the FDA there was guidance that was issued last year, I think it was, about enrolling more people in women's trials, and it sort of suffered a little bit of a hiatus and moratorium just under the current administration, as with Doji and all of the things in terms of scaling back on administrative officials. So that's the second thing that I'd be looking to, and I think finally, and on a personal level, for me, it's just continuing to work with really interesting people. So, with yourself, Sam, with, Nadenza, with Carsten, and just explore the untapped potential that there is in this country and, see if we can help and assist more startups get to market. And that for me is rewarding, seeing them succeed.
Amazing, Dev. Well, look, really good. This has been great. This has been a really, really rich conversation from my point of view, and I really appreciate you taking the time. And yeah, it's just been really, really fascinating to kind of dive into your story actually, and the ways in which, and there's such a sort of when you look back, it probably wasn't looking forwards, but looking back, there's such a clear path from where you were to where you are, and there's some really clear through lines. But it's been a sort of fascinating journey where you've taken these different tacks, and then it's great to be seeing you having the impact that you're having now.
Oh, that's very kind of you to say. Well, hopefully it's not over yet, so there might be another couple of tacks to be taken.
Yeah, right. All right, Dev. Really good to talk.
Great to catch up again, Sam. Speak soon.
Cheers. Bye for now.
Take care. Bye bye.